Let's talk Erie and the Joel Natale Show, live from our Kingdom Financial Group studio at 5th and State, also live on Facebook and YouTube, as we are doing another, for May, another Celebrate What's Different Conversations with the Barber National Institute. And I want to welcome in our guests here, Erin Landini-Grogran. She is a outpatient therapist, Barber Behavioral Health, outpatient therapy. Erin, welcome. Thanks so much for being here.
Thank you for having me.
And also we want to say hello to Dr. Emily Smith, a psychiatrist with the Barber National Institute and with AHN. Dr. Smith, good to see you, ma'am.
Thank you. I'm excited to be here.
Awesome. Alrighty, so May is Mental Health Awareness Month. It's a time to break the silence, confront stigma, shine a light on the full spectrum of mental health challenges. And today we're focusing on a struggle that often goes unseen, which is postpartum depression. Now, again, I didn't know any of these statistics. So postpartum depression affects 1 in 7 mothers, yet remains misunderstood, underdiagnosed. And so today we're going to make it our goal to educate, validate, and offer passive support. And we're going to begin with understanding what postpartum depression really is and why awareness during this particular month matters so much. So, Erin, let's get started here. Tell us about Mental Health Awareness Month and why this is an important distinction here.
So Mental Health Awareness Month, which was established in 1949 to bring awareness to the importance of mental health struggles and issues related to mental health as well as addiction, is captured in that month as well. What we really say is that let's bring out of the shadows those individuals who struggle, because historically, no one talked about it.
Yeah.
No one saw them. It was kind of, families shielded them away. Mental Health Awareness Month brings awareness to the fact that people do struggle, but also that there's help out there and that they need to be treated with that dignity and respect that they deserve.
You said it. The Awareness Month started in the 40s?
1949.
Wow. I mean, but when you think about it, generationally,
right,
it's been an issue, right? Some generations, like you say, just we don't talk about that. We don't talk about that particular uncle,
right,
that kind of thing, right?
Right. That, in the 40s, 50s, even to my grandparents' generation, that was not talked about. That was, oh, he's different, or he's strange, or, oh, that person was in an institution, but we don't talk about that person because we don't want to. It was a very much a quiet, stigmatized situation. In the 40s, it was brought to light, and each year we've seen, more information coming forth. And that's, I think, really important, especially when it comes to postpartum depression as well.
I'm not sure people knew that Barber National Institute had a whole program and wing that's behavioral health. Talk about that.
We do. So Barber Behavioral Health has services for children, as Dr. Smith will speak to, the acute program, but we also have an outpatient clinic that serves adults who are struggling with mental illness and who are seeking either medication management, and as well as psychotherapy. Both are offered, so they can come in for therapy. There's myself and another therapist there, but they can also see our psychiatrist who's on staff for medication. And there's also mental health services for children, and even little ones, early intervention. So there's a lot offered under that wing of Barber Behavioral Health.
So let's define terms then. What is postpartum depression versus, the baby blues?
Sure.
Right?
So baby blues, really, if you think about women having babies, 80% of women struggle with baby blues. And that's that kind of that extreme, emotional distress after childbirth. It differs for each woman. But really, when it becomes more intense or impacts the woman's daily functioning, we look at postpartum depression. So baby blues, that first week or so after you're out of the hospital, your body's adjusting. You're adjusting to bringing a baby home, which is, a big change.
Like a lot of hormones.
A lot of hormones, yeah. Right. And then postpartum depression, is a much more severe form of that. And when we see women with postpartum, what we're seeing is those moments of depression, just, extreme anxiety, panic attacks, not feeling connected to their child, which we'll talk about later about how that really impacts the family and society as a whole. But they don't feel connected. They don't feel like they're bonding with their child, therefore making them more depressed. They're isolating from their families, maybe sleeping more, maybe not sleeping at all. Symptoms vary for each woman, but it is 1 out of 7 women, and it has a very profound impact on women as well as families as a whole.
So when a woman is really truly dealing with postpartum depression, it's kind of an issue for the family, for the spouse, for the husband, the spouse, the other caregivers, the parents,
Absolutely.
the other children. Talk about that. Yeah.
Absolutely. So what you'll see is, the woman has the baby and everyone's like, oh, they had a baby. This is so exciting. This is so wonderful. And there's all this excitement. And this woman, the woman who has the child, basically is watching this happen thinking, I'm not connected to this. I'm not connected to this child. And then for many women, what comes with that is guilt, because we should be connected to our children, but we're not. So that guilt is also a big part of that. And, for families, spouses, are trying to step in and help. And it's really hard on everyone. It's hard on the other children. If there are other children in the home, it affects everybody, because mom is not her normal mom. She's withdrawn, she's sleeping, she's not engaging with anybody.
Let's talk about who's at risk here, and we'll go to Dr. Emily Smith again. What do you think are some of the misconceptions about postpartum depression?
So one of the things I think is a major misconception is that we're looking at just postpartum depression. And so we actually think of these things as a broader group of what we call postpartum mood and anxiety disorders. And so depression is just one of those. And so I've seen a lot of women basically think, well, I'm not sad, so I must not have some sort of postpartum problem. But a lot of women, it's actually a much larger anxiety component, and it's a lot of worry. And there's even a spectrum of postpartum OCD, which is super common and rarely talked about, where women have what we call intrusive thoughts, which are thoughts that kind of pop into their head that they kind of can't make go away. And it's often with moms struggling with depression and anxiety around a new baby about something bad might happen to the baby. Not that they want to do something to the baby, but like, oh, I'm having thoughts over and over again that I can't get out of my mind that, like, maybe my baby's going to stop breathing. I better check to make sure that he's still breathing. Okay, I just checked, but I went and got a cup of coffee. I better check again. And doing these sorts of things over and over again.
Is that different for the first-time mom compared to maybe the second and third time, or can it happen that onset in subsequent children?
It can happen in absolutely any pregnancy, and some people will experience a postpartum mood and anxiety disorder after only one of their babies. If they have several, sometimes someone will have it every time. People can be fine for 3 babies and then have it with their 4th baby.
Wow.
And so it can really happen at any pregnancy to any woman at any time. Some people are more at risk than others, but it can happen to anybody.
Talk about the biological and the hormones, and again, sleep deprivation, losing sleep is for real for any new parent, right? I mean,
yeah. So people are really being hit at this from 3 angles. There's the biological angle. There is the we are making a huge shift in the way that you live your life angle. And there's the sleep deprivation angle. So biologically, one of our pregnancy hormones called progesterone actually works on one of the receptors in your brain that tamps down the anxiety response while someone's actively pregnant. And that's not to say you can't be anxious while you're actively pregnant. Plenty of women are. But your body is working against that anxiety with that progesterone, which is great until the day that baby is born and it abruptly cuts off that supply. And so some people's brains just really don't tolerate that crash well, which is often why some women get depressed so hard and so fast very, very quickly. Wow. It tends to come on much harder and faster than other types of depression tend to, because we're really making a big brain change really, really quickly. And while we're doing that major brain change, you are completely changing the way that you have to live your life. You brought home a person who has no rule book. People have no idea how to do that. And you're not sleeping. So you're up at 3 o'clock in the morning. You're trying to deal with this baby. And all of this stuff is happening all at once. And that makes it a really high risk time for people's brains.
We're talking to Erin Landini-Grogran and Dr. Emily Smith. It's another Celebrate for What's Different, communications with the Barber National Institute. I'm wondering about how prior diagnoses of anxiety or depression would impact, the likelihood of postpartum.
So anytime that someone has had depression and anxiety or any sort of mental health condition before, it makes it more likely that they're going to possibly get that again. We have just shown that they have a brain at risk, and all of these things are episodic illnesses. So typically when someone struggles with depression and anxiety, they don't have it every single moment of every single day, but they just show us that their brain is at risk for having that sometimes. And this is a really high risk time for people. The highest risk time for a woman to have a psychiatric hospitalization is actually in the year postpartum for any of their pregnancies. And
a year?
A year.
Mm-hmm. Okay.
The sleep deprivation and things last that
Yes.
entire time. The changes in life last that entire time. It can take a long time for hormones to level out. During that time, there's different hormone shifts. If people stop breastfeeding or decide to, taper off of that, that's another hormone transition. The postpartum period's not just a few weeks. It's a long time. We consider it from birth anytime up until that baby's a year old.
Talk about some of the red flags and how we could bring support to that postpartum mom.
So red flags I see are lack of what I call mood responsiveness. So it's normal for women to cry and have, a little bit of a hard time when they come out of the hospital, but their mood should be reactive to good things. You should be able to feel happy when happy things happen. You should be understandably sad when sad things happen. And if you're not able to feel the joy in things, that's a sign that things aren't going well. If somebody's not taking care of themselves in the way that they usually do, if someone completely stops showering, eating, doing the things that they normally do to care for themselves, obviously, postpartum's a tough time. I'm not expecting people to be in their fanciest outfits with full faces of makeup. But typically, people who take care of themselves will still want to take care of themselves. And people should be interested and want to hang out with the new baby and want to show off their new baby. And if they're completely detached, that's a sign that maybe things aren't going well.
This Mental Health Awareness Month reminds us mental health affects everyone. Postpartum depression can touch families from every walk of life, right? So how do we access resources? How do we, plug in? And Erin, we'll go back to you. What are some of the options for help and treatment?
Absolutely. The recommendation that I would make initially is that when you go for that first postpartum appointment with your OBGYN, if you're suspecting any type of postpartum depression or anxiety, speak to your doctor at that point.
Okay, so let me just connect with this, because my understanding, and Dr. Emily, weigh in on this too. The idea is that the especially primary care, but I wonder if OB as well, are they getting uptrained on markers for depression and anxiety? Are you seeing that now on the OB side?
Absolutely. And so 2 places that someone gets screened for postpartum depression are both at their postpartum visit for the mom going in for her own care. And another place people are being screened for postpartum depression is at the first pediatrician visit for the baby. Because a lot of times moms are likely to skip that postpartum visit for herself, but usually will go to the visit for the baby. So we're way better at taking care of our kids than we are at taking care of ourselves. And so that's a good access point too. The pediatricians are helping to look.
So identifying right off the bat is the first step, right?
It sure is. And when I treat someone for psychotherapy, if I know that there's previous postpartum depression, probably month 4 to 5, we begin having that discussion in therapy. How are you feeling?
Month 4 to 5. Okay.
Yes. And especially depending on the severity of the woman's depression, we begin having that discussion. Are you talking to your doctor about it? Would you like me to link you up with a psychiatrist? It's that preemptive approach.
Yeah.
Because I think that's so keenly important in treating postpartum depression, awareness, and knowing those symptoms early on. And even for women who haven't had children, I will have that discussion. These are the things I want you to watch for. I may have like a 1-page handout here. This may be helpful to you. Just read it. You get it from the OB/GYN as well. But in that therapy session, I think it's really important to have that conversation.
What about community resources? Is there groups that you can join? Talk about that stuff.
So absolutely, there are, of course, individual psychotherapy. And I know that AHN, and I know Dr. Smith could speak to this, has an excellent program for women who have postpartum difficulties. And it's been recognized, I believe, AHN as a whole, for their work in that. I would definitely defer to Dr. Smith on that.
Talk about what some of the community resources are.
So I work at AHN Women's Behavioral Health, and we are a program specifically for pregnant and postpartum women dealing with mental health struggles. We have individual therapy, which unfortunately has a bit of a wait list right now because there's a lot of people seeking our resources. But we also have medication management for pregnant and postpartum women, and that has pretty immediate availability where people can come talk to us about, hey, is a medication something that's going to be right for you for postpartum depression or managing any mental health condition while someone's pregnant or postpartum. I've even had people come to me saying, hey, I'm planning a pregnancy and I know I have a history of depression, anxiety, OCD. Is it safe to stay on my medications? And we can have those discussions either before pregnancy or any time throughout a pregnancy so that people know what their options are.
Are they concerned about, having some meds go to the baby and all that? Or
so that is a concern. But the fact of the matter is that most medications are a risk-benefit discussion. It's not an absolutely, yes, this is 100% fine. It's not an absolutely, no, you can't do this. It's, hey, there are some small risks and there are definitely benefits to your mental health. Let's talk about what sort of risks that you're comfortable with and make a decision together. But the answer is usually not, no, you absolutely cannot stay on this medication. It's, hey, let's think about things together and make a decision as to what you feel more comfortable with.
So let's bring this plane in for Lanny and start talking about how we as individuals, me as a dad, as a spouse, maybe a new dad, could be supportive for those that are dealing with postpartum.
Absolutely. First of all, with anyone who's postpartum, if you can take a task off a woman's plate, please take a task off that woman's plate.
Right.
You are not just going there to hold a baby. You are going there to hold a baby and also throw in a load of laundry or bring a lasagna.
Right.
Let someone take a nap because people just need a second sometimes to breathe, and they just need to know that you're there. And so one of the things that I see people do that really concerns me is that people will be like, well, every new mom struggles. You decided to do this. You knew this was hard when you signed up for this. And that's so invalidating because just because other people struggle doesn't mean that someone's not struggling. Of just like, hey, I know this is hard. Do you want to talk about it? Do you want me to, let you know what resources are available? Do you want me to just like sit here and watch the baby while you go take a shower? Like, what can I do that's actually helpful? And make some suggestions, because just saying, hey, what can I do that's helpful to someone who's so overwhelmed? It's like, hey, why don't I make you some dinner? Just giving some options so that somebody doesn't have to sit there, be overwhelmed, and make a ton of decisions.
It sounds like it would be helpful to have like some kind of a checklist or a idea starter, conversation starter, especially if you're dealing with someone that's really kind of struggling. Don't you think, Erin?
Absolutely, I do. And what I think is so important, and like Dr. Smith said, is that when you have postpartum depression, everything's overwhelming. Mm-hmm. And for someone to say, oh, every woman goes through this, or come on, you can be stronger, you're a strong woman, has nothing to do with that. It's quite simply, you're so overwhelmed and you're so anxious and you're feeling like no matter what you do, it's not good enough. So to have people around you to understand that, but also say, hey, I brought you dinner, or go take a shower. Why don't you and your husband go out to dinner? We'll stay with the baby. All those things are so important, but to bring women that are isolating slowly out of that isolation is, so important. And friends, family, whoever is your support system around you can do that.
Yeah. So you really don't want to be dismissive. You want to help. And again, what's some of those really kind of dangerous things that you should not say?
Sure. I mean, every woman goes through this.
Yeah.
You just had a baby, you should be happy. You signed up for this. You know what happens when you have a baby. Mm-hmm. maybe you should have thought of this before you had this child.
Wow.
I mean, there are a lot of things that people say is similar to that. Our family doesn't do depression. I've heard, clients say, my mom said our family doesn't do that, but you're doing that. And how are we going to help you? So to just, make this broad, statement that we don't do that completely is so dismissive and just is so hurtful to a woman who's struggling.
The thing I learned immediately is that this can be something that would crop up much later than just immediately after the birth. I had no idea.
Right. I've seen women who have had their child 6 months in, 6 months, baby's growing, baby's healthy, and mom's saying, I don't feel right. Something's off. And then we start exploring, there's, different scales and testing and that, we use in an outpatient setting and have that discussion. What are our next steps?
Well, this has been an amazing Celebrate What's Different conversations with the Barber National Institute on the silent struggle, understanding postpartum depression. I want to thank Erin Landini-Grogran and Dr. Emily Smith. Thank you, ladies, so much for joining us today and
Absolutely.
sharing
Thank you.
this amazing content, amazing expertise.
Thank you.
Appreciate it very much. It's Talk Erie and the Joel Natale Show. Continuing on.